Good morning from Dr. Mackay, Vein and Circulation Specialist. We're once again with the lovely Dr. Mackay. Good morning.
Good morning. Thanks for being here.
Yeah, we're glad to be here again talking about veins and circulation again. And we're going to talk about something that I know you get asked a lot about here in the office, and that's about insurance. And do some of these procedures that you do, are they covered by insurance? But before we get into that this morning, Doctor, talk a little bit about why it is that people come and see you. Talk about what you're doing here in the office, what your specialty is.
Well, our specialty is venous disease, and the biggest part of that is varicose veins. So we treat a lot of people with varicose veins that are symptomatic and causing them problems. But we also see people for cosmetic concerns as well, and we treat that. And then we see people with chronic venous conditions that maybe from old blood clots, things like that, that have caused damage to their veins, and we can see some of those as well. And
there's a number of different procedures that I know you use here. They're changing, the technology is changing, which I guess kind of goes into the question of insurance too. I mean, how do you figure out which is the best procedure for them? And then again, does insurance cover it?
Well, the first step is usually we have to see you, find out what's going on. Then most insurance companies require a period of conservative therapy. Many times people's symptoms can be alleviated with stockings or massage, manual lymphatic drainage, a special kind of massage, and some people need weight loss. But all those things are part of the conservative therapy that we try and do first. If that fails, then we can move on to different procedures, and there's really a whole lot of new procedures as well as ones that have been around a while. And the insurance companies sometimes are a little slow to pick up on the new procedures, so it kind of all depends on what insurance you have, you know, whether they're going to accept, say, the Claravane catheter, which is a new catheter that where you don't have a lot of numbing required, very painless, or the Varithena, which is a new sclerosant that comes from a little canister. That too is very new. Works real well, but again, some insurances don't cover it yet.
Will you have to have a referral to come and see you? Is this something that people can call you first? What do you generally kind of see, especially with insurance companies as well?
It runs the gamut. Again, usually you have to call. We check your insurance. Some require referral from their primary care. Most don't. And then once we see you, evaluate you, usually prescribe a course of conservative therapy first, and then if that's not working, then then the insurance company, you know, will allow us to do one of these other procedures normally.
Again, consultations, I know you always like to say that's the first place to start. Talk about real briefly, though, the symptoms that someone might want to go ahead and say, you know what, yeah, let me look into this further. What are those kind of beginning, those generalized symptoms?
Well, a lot of people have, first of all, visible varicose veins. Now, if that's all there is, the insurance company wouldn't cover it because that's just a cosmetic concern. But along with that usually comes some pain, swelling around the ankle, or just tiredness and a fatigue in the legs, that usually by the end of the day. If they start noticing skin changes, swelling with some skin changes around the ankle, then that's really getting more serious and really need to be treated and evaluated and treated.
Well, and again, Dr. Mackay, the first step to do is make that consultation. I know you're happy to see patients, see if this is an option for you. Some of the procedures that are done here, they will check to make sure that some of it is done by insurance if it can be. And Dr. Mackay, thank you so much for allowing us to be here today.
Well, thanks for coming.
We look forward to seeing you again soon.
Okay, thanks for coming.
For more info, head to our website too, tbmorningblend.com.